Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical practice. Today we're going to go over ultrasounds in pregnancy. So ultrasounds are a great, valuable tool for pregnancy, very safe and very effective at providing lots of great information. And I'm sure you're probably excited to get one if you haven't already had one. So the first ultrasound, generally speaking, that you get is between 8 and 12 weeks, and that's to estimate how far along you are. So the early ultrasound is more accurate for determining how far along you are. But the baby is small, so you can't see too much detail. So another ultrasound is generally planned around 18 to 22 weeks, where you can get the anatomy, to look at the organs, to look at the way the baby is developing and make sure everything's okay with your baby. And those are the main two ultrasounds that you're going to get. Now, you might have one later to determine if the baby is growing well, based upon your exam, whether it's looking too large or too small, to look at the fluid level, or if you have other medical conditions that warrant further investigation, like diabetes of pregnancy, where you're requiring some medicine, or high blood pressure pregnancy, or other problems. And then you might get regular ultrasounds to look at the fluid, to look at the blood flow in the umbilical cord, all kinds of ways to assess the well-being of the baby. But generally speaking, most women in the United States get just 2 ultrasounds. And you may be wondering, well, why is the first ultrasound better for dates, and why don't they change my dates as they move along in pregnancy? And the reason is that the further along you are in pregnancy, the less accurate the ultrasound is at determining the baby's age, because all babies start out the same size, but then as time progresses, you have big babies and small babies, but they're using the size of the baby to determine the age of the baby. And that's why approximately in the first trimester, the ultrasound estimation of how far along you are can be off by about a week. In the second trimester, about 2 weeks, and in the third trimester, about 3 weeks. Just a rule of thumb, not completely accurate. So I hope that you have found this information helpful, and we welcome your feedback. Thank you.